In this video by DeckPlate we will understand the VA ratings for temporomandibular disorder TMD, maxilla, mandible, condyloid process, hard palate, loss of teeth, maxilla and neoplasm. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Veterans experiencing issues with their jaw, teeth and related structures can seek VA compensation. Here's a detailed look at the diagnostic codes and the corresponding ratings. Maxilla or mandible issues. Chronic osteomyelitis, osteonecrosis or osteoradionecrosis, diagnostic code 9900, rated as chronic osteomyelitis under code 5000. Mandible, loss of, diagnostic code 9901. Complete loss between angles, 100%. Mandible, loss of, diagnostic code 9902. Loss of one half or more. Involving temporomandibular articulation. Not replaceable by prosthesis, 70%. Replaceable by prosthesis, 50%. Not involving temporomandibular articulation. Not replaceable by prosthesis, 40%. Replaceable by prosthesis, 30%. Loss of less than one half. Involving temporomandibular articulation. Not replaceable by prosthesis, 70%. Replaceable by prosthesis, 50%. Not involving temporomandibular articulation. Not replaceable by prosthesis, 20%. Replaceable by prosthesis, 10%. Mandible, non-union of, diagnostic code 9903. Severe, with false motion, 30%. Moderate, without false motion, 10%. Mandible, malunion of, diagnostic code 9904. Severe anterior or posterior open bite, 20%. Moderate anterior or posterior, open bite, 10%. No open bite, 0%. Temporomandibular disorder, TMD. Diagnostic code 9905. Interincisal range 0 to 10 millimeters. With dietary restrictions to all mechanically altered foods, 50%. Without dietary restrictions, 40%. 11 to 20 millimeters. With dietary restrictions, 40%. Without dietary restrictions, 30%. 21 to 29 millimeters. With dietary restrictions to full liquid and pureed foods, 40%. With dietary restrictions to soft and semi-solid foods, 30%. Without dietary restrictions, 20%. 30 to 34 millimeters. With dietary restrictions to full liquid and pureed foods, 30%. With dietary restrictions to soft and semi-solid foods, 20%. Without dietary restrictions, 10%. Lateral excursion range of motion. 0 to 4 millimeters, 10%. Note: ratings for limited interincisal movement shall not be combined with ratings for limited lateral excursion. The normal maximum unassisted range of vertical jaw opening is 35 to 50 millimeters. Mechanically altered foods include full liquid, puree, soft and semi-solid foods. Condyloid process, loss of, diagnostic code 9908. One or both sides, 30% coronoid process, loss of, diagnostic code 9909. Bilateral, 20%. Unilateral, 10%. Hard palate, loss of, diagnostic code 9911. Loss of half or more, not replaceable by prosthesis, 30%. Loss of less than half, not replaceable by prosthesis, 20%. Loss of half or more, replaceable by prosthesis, 10%. Loss of less than half, replaceable by prosthesis, 0%. Teeth, loss of, diagnostic code 9913. Where the lost masticatory surface cannot be restored by suitable prosthesis. Loss of all teeth, 40%. Loss of all upper teeth, 30%. Loss of all lower teeth, 30%. All upper and lower posterior teeth missing, 20%. All upper and lower anterior teeth missing, 20%. All upper anterior teeth missing, 10%. All lower anterior teeth missing, 10%. All upper and lower teeth on one side missing, 10%. Where the loss of masticatory surface can be restored by suitable prosthesis, 0%. Note: these ratings apply only to bone loss through trauma or disease, not to the loss of the alveolar process due to periodontal disease. Maxilla. Loss of more than half. Diagnostic code, 9914. Not replaceable by prosthesis, 100%. Replaceable by prosthesis, 50%. Maxilla. Loss of half or less. Diagnostic code, 9915. Loss of 25 to 50%. Not replaceable by prosthesis, 40%. Replaceable by prosthesis, 30%. Loss of less than 25%. Not replaceable by prosthesis, 20%. Replaceable by prosthesis, 0%. Maxilla, malunion or non-union of. Diagnostic code, 9916. Non-union. With false motion, 30%. Without false motion, 10%. Malunion. Causing severe anterior or posterior open bite, 30%. Causing moderate anterior or posterior open bite, 10%. Causing mild anterior or posterior open bite, 0%. Note: maxillary non-union must be confirmed by diagnostic imaging studies. Neoplasm, hard and soft tissue, benign. Diagnostic code 9917. Rated as loss of supporting structures, bone or teeth, or functional impairment due to scarring. Neoplasm, hard and soft tissue, malignant. Diagnostic code 9918. 100% rating continues beyond cessation of treatment. 6 months after discontinuance, a VA examination will determine the appropriate rating based on residuals such as loss of supporting structures or functional impairment due to scarring. Thank you for watching this video. Please don't forget to subscribe and like our videos.